To combat the problem of racism in biomedical and neuroscience research, some say we shouldn't consider race at all, while others argue that we should examine differences associated with race much more deliberately. What might be the reasons for these contradictory calls? Some of the answers lie in the history of how race has been used in research. While today we know that genetic variation among humans doesn't correspond well to the social groupings we call race, many scientists believed that racial categories represented biologically and genetically distinct groups. This belief is known as biological essentialism. Beyond being scientifically inaccurate, why would this area lead to controversy about including race in research? Historically, biological essentialism has been used to justify attempts to prove the existence of a racial hierarchy. For example, Pierre-Paul Broca, best known for his discovery of an important brain center for speech and language function, viewed different racial groups as distinct species. He set out to prove the variations in skull shape and size between black and white individuals accounted for differences in intelligence. The belief held by Broca and others that different races fell along a biological spectrum from barbaric to civilized was in turn used to enforce racist policies like slavery and colonialism. The interweaving of science and racial bigotry has deep roots in many fields, even those we might think of as highly objective and unbiased, like statistics. Many of the statistical tools and methods we use today were developed to support research on heredity and eugenics. For example, the normal curve was fundamental to identifying superior and inferior individuals. Beliefs about biological essentialism and the inherent inferiority of some races also set the stage for exploitation and abuse. For example, in the mid-1800s, Marion Sims, sometimes hailed as the father of modern gynecology, developed his surgical methods by conducting experiments on enslaved black women without anesthetic. The dehumanization of black people was associated with the belief that they did not feel pain. More recently, in the 1940s and 50s, Canadian researchers experimented on malnourished Indigenous children in residential schools without parental consent, denying them adequate nutrition and allowing them to become extremely sick and die. Examples like these have caused a lot of harm and damaged people's trust in research. But that was history. What role does race play in science and medicine today? While essentialist notions of race have been largely discredited, the after effects remain. For example, black patients are still less likely to be prescribed pain medication than white patients due to enduring misconceptions about black people having thicker skin or less sensitive nerve endings. In fact, despite ample evidence that political and social determinants strongly influence health disparities, a 2016 study analyzing in-class content shown to medical students found that associations between race and health were presented as stemming from biological differences over 95% of the time. Among both scientists and the public, there is a persistent tendency to jump to biological and genetic explanations for health inequities. Most recently, when data showed that black people in North America were disproportionately contracting and dying from COVID-19, many commentators implied that the disparity must be linked to genetic factors. However, there is no evidence for such a conclusion. There are many reasons why black people were more vulnerable to getting COVID-19, including poverty, working in essential service jobs, and relying on public transportation. If healthcare is out of reach or unaffordable, the outcome can be deadly. So why consider race at all? Given the ethical complexities associated with studying race, some might decide that it's easier to take a colorblind approach and simply ignore race in scientific research. But this strategy comes with its own set of problems. Race may be a social construct, but it still captures meaningful variation in health outcomes and vulnerability to illness. Differences created by social conditions have biological consequences, and ignoring race may prevent us from detecting and addressing important health disparities, like those exposed by COVID-19. Racism itself is a known stressor and has been shown to have a large impact on health. Other problems of ignoring race are illustrated by the persistent lack of diversity in research samples, despite repeated calls for inclusion. When researchers rely largely on white male participant groups, the results may not be generalizable to the wider population. When new drugs or therapies are being researched, the failure to include diverse participants presents concerns around safety and efficacy. Representation in clinical trials is a question of health equity for groups who have traditionally been underserved by the medical community. Who is given access to novel therapies? And does this accurately reflect who is most impacted by a disease? Recently, 2 separate vaccine trials for COVID-19 took place, showing promising results. However, the participants in both trials were roughly 90% white, despite the fact that Black and Latino people are known to be disproportionately impacted by the virus. Following an outcry, the next vaccine trials are deliberately targeting more representative samples. As researchers, the question we are left with is this: how do we analyze and report on meaningful associations between race and health outcomes without buying into biological essentialism and the harmful beliefs that stem from it? There are no simple solutions. Instead, let's reflect on our own assumptions about race. Let's be thoughtful about how we define racial categories in our data. If we find differences linked to race, let's ask where those differences come from. Thinking about these kinds of questions and discussing them openly when presenting our data may prevent the misuse of race-based findings and lead to a deeper understanding of human variation.